Hi, this is Dr. John Suber, plastic surgeon, and welcome to Straight Talk on Plastic Surgery. This video segment is going to be centered around a series of questions asked by numerous viewers relating to the timing of plastic surgery, where exercise ends and plastic surgery might begin, and managing excess skin and tissue, and the difference between assessing excess skin versus remaining subcutaneous fat when one looks at one's own belly. Well, the email that prompted this question, I've got to read you this title to this email, and it reads, do I have to have plastic surgery to look good naked? That is one of the best titles I've gotten so far, and that's a real pithy comment, but the question behind it is actually quite good. She wants to know if she has to have plastic surgery to get that sexy look, her words, or will she eventually get that body by working out alone? Well, these are good questions, and I'll answer that by saying that first off, the timing of your visit with a plastic surgeon is important, I think, because even visiting a plastic surgery early on may give you some information that can help you along the way as you're losing weight. Some of my previous videos have touched on issues relating to points I'd love to get across to people on their weight loss journey early on in the process that may help them along the way. But visiting a experienced and well-trained plastic surgeon who manages the type of issues that you, the potential patient, are addressing or wanting addressed is very important. But I'm talking about the timing of a visit close to operative time where you might begin to plan out potential plastic surgery. Well, if you're a weight loss patient, then obviously, just like your gastric bypass surgeon should be telling you, when you're getting towards your goal weight and or when your weight is stabilized, plateaued, and you're at a point where you feel like you're near the end of that segment of your journey, it's a good time to visit your plastic surgeon to get assessed. Now, when you're assessing your own body area, be it arm, be it thigh, abdomen, the old special K rule of pinching an inch, not literally an inch, but being able to pinch that tissue is a big difference. When you pinch the abdominal skin and it's thin and very mobile, and there's not a lot of thickness there, that generally represents that you're getting to a point of significant skin excess, and that subcutaneous tissue, the fat that remains, may be to a point where you're amenable for plastic surgery. Now, in my exam, generally speaking, with many patients, I don't worry too much about any fatty tissue that's below the navel, because by and large that's going to be, as we would say, in the bucket anyway. But I'm assessing the upper and the upper lateral abdomen. When that skin is thin and mobile and not very thick, then I can say to myself, this patient is at a point where she's probably, from the abdomen standpoint, settled out with most of her weight loss, and we might be able to make some early plans on potential surgery. As far as skin quality as it relates to massive weight loss patients and the email that I referred to earlier, I like to give the analogy that skin is like a bed mattress. If you can envision that. Within that mattress are coils, springs, and that's the elastin fiber content of the skin, and the filler material is the collagen material. And each of you have heard that term relating to skin, but understand with weight loss population, the elastin and collagen content is distorted, damaged, and to some degree irrevocably so. So even after we tighten things up, things can loosen. That's another conversation for another video. But the point is, exercise, diet, and time is only going to allow that skin to recoil to a certain degree. I've seen people that have lost a lot of weight whose breasts were fine as far as surgery goes. The only thing they would benefit from was an augmentation There was no need for a lift. That's rare, but it's possible. I've seen people whose arms did fine and they required or benefited from surgery elsewhere. It really has to do with genetically and historically where you have carried excess weight and tissue. So you can have just about any scenario as far as what will tighten up and loosen up, and it depends on where you were preoperatively and where you are at the end of your goal weight. Generally speaking, though, skin has a difficult time contracting fully from an obese position down to a normal weight position without a patient benefiting from excess skin removal. So I'm a little bit pessimistic about someone being able to avoid plastic surgery altogether, generally speaking, but there certainly are exceptions to the rule. And being a conservative-minded plastic surgeon myself, my goal is always do the least I can do to meet your goals. If I can do a less invasive procedure or a smaller scale procedure to meet your goals, that's what I want to do. And I'll be the first one to tell you if on exam that's the case for you. And of course, please remember this video series and this particular video is not designed to replace a one-on-one consultation with a well-trained, experienced plastic surgeon in your area of interest. So do keep that in mind. So in short, it's difficult to avoid plastic surgery altogether in the massive weight loss population if your goal is to get as much excess skin out as you can. It's rare that your body will just recoil that on your own, number one. Number two, the skin pinch test, especially in my hands for the upper abdomen, for someone who's losing weight and considering abdominoplasty surgery, is a test that tells me when someone is approaching the time where they may be a good candidate for that procedure. Thanks for the entertaining emails, guys. It really makes my experience here more fun, and I appreciate it. I hope this video has helped you out. Remember, email your questions to me here via YouTube. In the meantime, don't forget, wherever you are, life is good.